who should be able to access health and care at that point of need. We're also going to hear from the winner of our PPI Clinical Audit Hero Award about their experiences of engaging and involving the patients and the public in improving health and care. So if we move on to the next slide, we can look at the agenda a little bit more closely. So we are again this year going to touch on the importance of Clinical Audit Awareness Week to the clinical audit and wider quality improvement community, and of course today involving the patients and the public in clinical audit for improving health and care. Bren will speak with us all on the national agenda, as we just mentioned, and thoughts for that local application before moving on to announce our Clinical Audit Hero. We'll then hear our Clinical Audit Hero present their winning submission. There'll be the opportunity to ask questions. Please do post in the chat as we move through this session. If we don't get a chance to answer all your questions raised, we're going to collate a Q&A document that we'll post after the lunch and learn with published responses where we can. Before we close at 1:30, we'll ask you to join in with an interactive evaluation on screen. We do absolutely value your feedback on what we think's worked well, what could be made even better. And Jordan, our North East Clinical Audit Network Chair, is going to walk us through those questions. So you'll be able to see them come up on the screen. Please do also think, as we're going through today, about taking away that challenge for yourself to take forward in your own organisation. And we mentioned yesterday on the Lunch and Learn about the NHS Impact, that single improvement approach that's now being launched through NHS England. And it's trying to keep that in mind as well as you're starting to take away objectives for yourself to take forward in your own organisation to make better. So if we move on to the next slide then please, Sonia, we're just going to give a recap on NQICAN for anybody that's not familiar with it. Apologies for anybody that might have been on the Lunch and Learn yesterday, because obviously you'll already have heard this, but we're always saying we can never share this information enough. So currently NQICAN's got 11 regional networks. If you're not yet a member of your regional network, please do contact us. We'll put you in contact with who your network chair is. We will post our NQICAN email into the chat as we're going through sessions so that you can pop an email off to us. NQICAN's got a common purpose and a forward plan to support us all in high quality local programmes that improve health and care for our patients. And our regional network chairs are actively involved in this, and they provide that voice into NQICAN from all the types of health and social care organisations in the networks, and obviously takes that voice back out to the networks from bodies such as NHS England, Healthcare Quality Improvement Partnership, NICE, Getting It Right First Time and more. We do hold open meetings quarterly with free to access links shared, with the next meeting being held next week on the 29th of June at 10 AM, and we're planning to hear from the CQC on the new inspection framework and what this means for clinical audit, so please do join us if you can. We've got a national network and sharing forum where we learn and share together. Again, if you're not a registered member, head on over to the link that we're going to pop into the chat and you can request to join. We did more recently see the launch of the National Learning and Knowledge Hub on the NHS Futures platform, very much focused around taking action on national clinical audit findings. It's about a community coming together to support one another, to celebrate where we have achieved quality improvements for our local communities, and providing examples and case studies of how we've managed to make things even better. What works well in one organisation could actually be applied to another. So as always, we follow the 4 stages of clinical audit that you can see here, and we identify an area where we need to improve. We undertake that measurement for improvement to see where we are, and then we apply those other quality improvement tools and techniques to really understand where we're not getting it right and how we can implement improvement actions to make sure that we do. And then we always move on to evaluate that impact. And the topics this week are touching on all of that as we go through each day. Just going to briefly mention here HQIP's quality improvement magazine called Cornerstone that was recently launched. It's a new online free publication. It's designed to support quality improvement in health and care, aimed at anyone that's passionate about improving patient outcomes through evidence-based care and services. And you can access that link on the Healthcare Quality Improvement Partnership website. So we'll try and pop that link in the chat for you as well. So this week, it's all about taking time out to reflect on what we have achieved since last Clinical Audit Awareness Week last June, and where we want to be by next year when we're looking at Clinical Audit Awareness Week 24. That opportunity to celebrate what we achieve through clinical audit every day, not just about that 1 week in time, but it's what we're all pledging to continue to achieve through year. It's that move to continuous improvement. We want to learn and share together on a much more wider scale. We want to understand the challenges to get the most from clinical audit as that quality improvement tool, that quality improvement process. So let's take time to reflect, look at what's working, maybe where it's not quite right or where we need to strengthen, set ourselves some objectives to take away from this week back to our own organisations, teams, patients and service users. If we just move on to the next slide, I just wanted to remind you all some objectives we set you at the end of the last Lunch and Learn last year on patient and public involvement. And it was around going back to your own organisation and checking how your clinical audit strategy aligns with your patient and public involvement strategy, looking at your audit programmes and checking that they included measurement on issues or concerns raised by the patients and the public. And did you actually involve them within those audits? And we also asked you to look to see if there were actions taken forward with a focus on making it better for patients and patient experience. So we'd love to hear how you've got on. So please do post in the chat on the progress that you've made over the last 12 months. And then finally, on the next slide, just before I hand over to Bren, this is what you told us last year on the Mentimeter. For those that joined us at the September Open meeting in September 22, we did share this information with you then when we looked at the evaluation. But it's just a nice recap today before we hand over to Bren to take us through the latest really in terms of information and resources that we need to be thinking about. We asked you in terms of clinical audit, what does patient and public involvement mean to you? And these were some of the words, as you worded them, that came up on Menti. And it was about that positive and inclusive step forward. It was about having those open and honest conversations, accessing and utilising those existing patient groups so that we're gaining their thoughts and ideas, working collaboratively, jointly to design those clinical audits on topics that actually matter to patients, but also looking at the standards that are important to them as well, not just us as providers and commissioners of health and care. And then it's truly aligning that vision between patients and care providers. And then finally, just a thought from myself before we hand over to Bren, really, effectively involving patients in clinical audit enables them to actually describe their insight about how their care should be. The public can advocate from a patient's perspective, and health and care staff can make the improvements that matter most to our local communities. So I'm going to move on to the next slide now, and we're actually going to now hand over to Bren McGowan, who's the policy Head of Policy at Healthwatch. So it's over to you, Bren.
Thank you. And you've just promoted me. I'm not actually Head of Policy. I'm Policy Advisor. But thanks for the faith in what I'm saying. So yeah, I'm at Healthwatch England. I've been here 5 years, but before that, I've had most of my career has had some element of public engagement, either very broadly or in health. So if we go on to the next slide. So I'm basically going to be talking about patient and public involvement. And at this point, I'll say that this was prepared before I'd seen the earlier slides, but it picks up on a lot of the things that are mentioned there, of the things that are important to you, about how we make sure that we get patient voice and how we listen to it. So if we can go on to the next slide. I don't make the mistake of assuming that everybody knows in detail what Healthwatch does. But basically, we're here to amplify people's voices so that they are heard by decision makers, and that's both locally and nationally. So we have round about 150 local Healthwatch. The number changes depending on local authority of the organisation, but they are very closely linked into Healthwatch England, so that we're working at various levels. We're working really at neighbourhood, place, system and nationally. And what is really important for us is that we are seen to be independent and impartial. And we're in a peculiar place that we are a statutory requirement, but we're not really seen as being part of that infrastructure. That independence is important. And I'll probably be saying more about that later. If we could go on to the next slide. When we talk about patient involvement, engagement, there are just so many words people use, and sometimes people can get quite worried about, are you using the right word? Should we be saying something different? What will it mean to the public? I tend to take the line, as long as you know what you're planning to do, the language is probably less important. So the statutory guidance, and there's a link to that at the bottom, talks about working with people and the community, and that's really what it's about. But there are all these things you can use. These are all part of listening to what people say, and they all have their benefits and also some of the difficulties associated with them. So feedback at its most basic, that can make a real difference. If you're doing consultation engagement, they may give you something different, they're different approaches. But also complaints. Do we learn from complaints? Many organisations do, so that becomes quite important. And whether you're doing something that's an interview that can be quite formal, or whether it's just a conversation with somebody at an event, these all have something really important to offer. So whatever you're doing, it can fit into this framework. And my advice to people is always, probably don't get too precious about trying to put it into a particular framework. Be clear about how you're going to talk to people, and more importantly, how you're going to use what they tell you. If we can move to the next slide. It's coming. What I'm going to do is take you through examples from the Healthwatch network of different ways that people have involved local people. Healthwatch Oxfordshire developed a programme around community researchers, and that was sending out people to work with local communities and find out what's important to them and why, and to get more information around that. One of their projects worked with women in the community, and it really found out that the experience from women particularly from Black and Asian communities were a real concern. And basing it around an event, which was as simple as getting women to talk about their experiences, what was good for them, what didn't work, and what needed improvement. And they recorded this. It's basically a recorded conversation, and there is a link to that when you get slides. And I have to say, I expected it to be an interesting experience. I didn't realise that it was going to be quite so moving when you heard about how different people's experiences were, from the women who described their midwife as being like a family member who was there for them all the time, to women who were basically told, you can cope with this, we're not going to take you in yet. They're really different experiences, and we can really learn by listening to those. And among the outcomes that they had there was getting mothers talking to staff about their experiences, so that the hospital understood better what the individual experiences were like. But also, and I think this felt very positive for me, involving women who'd been involved in this project, bringing them along to training sessions for people who were planning to go into nursing, so that they understood from a patient's point of view, from somebody using a service, what it was like for them. And if we go on to the next slide, we can see what one of the researchers said. about how it was important. But what I draw your attention to is where she says, and I was thinking this is amazing. I thought, yes, there is no way you can't learn something from it. And that's one of the important things, that it's not necessarily about having a fixed view about what you will learn. You can hear so much and different people will take different things from it. And that is actually fine. It's actually probably better that different people are taking different things and taking it back into their way of working, it into their organisations. I will say again that there's a link to the video. I would advise you to watch that. That was a real game changer for me. If we could go on to the next slide. Again, looking at hospitals, Healthwatch in Northamptonshire made 43 visits to 36 wards, so that's quite a commitment. Healthwatch have a statutory function they can use, which is called Enter and View, which allows them to observe how services are working. And as part of that, they will talk to service users. In theory, they can do unannounced visits. Those are actually very rare because they want to get the best out of the visit, and the best way is really to plan it with the service that they want to see. And here you can see something that was an incredibly complex programme of activity covering 12 months, where they were able to see a range of services that were there. And again, what is important about this is they talk about both what works well and what doesn't. So many comments about how staff were helpful, particularly, and this is something we hear about a lot, communication is important. And if you think in many services, people are they're most vulnerable when they're using the service. So communication is really important. But what's also, for me, really heartening about this is the way the hospital responded, including with some issues saying, get in touch at a senior level immediately if there are some important issues. Pardon me, and looking at the report, there are lots of things where it wasn't new to the hospital. What it confirmed was what they already suspected. And that's something else that communities are great for doing. Engagement can both confirm what you believe, but also sometimes provide you a bit of a challenge. And on the next slide, if we can go to that, we can see what one of the volunteers mentioned. And this is just a small win, but it's looking at hand washing. When they saw that wasn't available and heard about it from lots of people, just a suggestion about hand wipes, which has been now adopted across the hospital. One of the things it also mentioned, and not quite in passing, but not as something that was a major issue, was, and I got to learn the jargon, BBE, bare below the elbow. Well, actually, they saw some staff who weren't, and they questioned that. And again, that was something where the hospital was perhaps more interested than they expected. So again, that insight from seeing something with fresh eyes. Again, that is something that we hear often from services that we're working with, is having somebody who is coming in, doesn't know the way things normally work. They may see those things, and that is vital information for you. If we could go on to the next slide. And this is something we did at Healthwatch England, a different approach. This was about using a national survey that was open to anybody who wanted to respond. So it wasn't weighted or going out to find particular people. It was getting new mothers to share their experience, and over 2,500 responses. What we found interesting about this, and you can see the main findings there. If we'd approached this in a tick box way, we would probably found that many new mothers were having the postnatal checks, but we wouldn't have found how well they were working. And looking at the report, a number of reports where there was what was allegedly the postnatal consultation, but it actually focused more on the child and the needs of the mother. So again, by having that conversation, you get to find out more about what individual experiences are, and it becomes really important because it is much more significant if you know more than the number. So then you might get a number about how many consultations are taking place. They really don't tell you how well they're working for the new mums. And if we get a new mum's view of how things were working on the next slide, if we can go to that, we can see something around waiting longer than the 6 weeks for any sort of contact, and really important that it was helpful, but it was too late. And that again is something that's a key message, that some of these things, they need to have a sense of urgency about them, and particularly, having read some of the cases, you can see why it's important that it's picked up at the earliest opportunity. If we can go on to the next slide, this was something that I was involved with, and it was during the pandemic, and it was one of those strange things where I had to start asking people about what's happening with DNA CPR, do not resuscitate orders, because we started getting questions about them, and it was something that was new from our perspective. We weren't having them. The concerns were different in different areas. Some of them were individual, some of them were about whole services, some of them about care homes and different experiences there. When we started raising this and we went to CQC, we found that other organisations were hearing that as well. And so that becomes actually really important, that if you listen to different organisations, you will find more. The CQC was then commissioned by Department of Health and Social Care to look at the concerns and produced a report that set out clearly how things should work. And certainly we contributed to that, as did as did a wide range of organisations. That all sounds very positive, but I have to say, 2 years later, we're still getting concerns from patients' families where it doesn't sound as if the protocols have been followed. So there are still concerns with that, and it's still something that we're looking at. If we could move on to the next slide. Here we have an example of something that came from one person. And Sharon, who is the lady on the left-hand side of the picture, she, and I've heard her speak about this, she received an invitation for mammogram, and it was in plain English, and that was fine. But when she received a recall letter, it wasn't, and that caused her real distress. She had to wait, it was several hours before there was someone who could read it for her. That might not sound much to you, but when she talks about the real sense of fear that she had about that, nobody should go through that. She worked with Healthwatch Sunderland and NHS England, and actually quite a simple solution. There are now template letters for follow-up meetings and for follow-up sessions. And it makes, I mean, it is such a simple solution. My only question about it is why it took somehow managed to get muted then. If we look at what Sharon said on the next slide, there's another important message for this, where she says she feels good that she's been able to help so many women across the country. Often when people are responding to things like this, they really want to help other people, and that's something to bear in mind. If we can go on to the next slide. Again, during the pandemic, we got lots of unsolicited feedback. We knew a lot of it was about access to NHS dentistry. And that was something where we could see the situation was changing. It had been difficult in some areas before the pandemic, but come the pandemic, it was becoming a problem everywhere. But we also heard about all sorts of other things, such as charges, the way they were issued and being given wrong information, actually causing people some problems. We also heard about the standard of treatment, either people reporting poor treatment or sometimes incomplete treatment and being unable to finish what they thought was an agreed course of treatment. But also going back to what we talked about at the hospital, lack of infection control, which is a real surprise for me. I know when I saw my dentist, it looked like he was about to do some welding, the amount of cover he had. But if we go to the next slide, we can see what somebody else's experience was. And this was seeing a dentist who was not wearing a mask. It is somebody who had real concerns about that, but was not in a position or didn't feel in a position to do anything about it. And again, these things are really important. Certainly with with feedback like this, it's something that we will always take forward. So there's a range of different approaches that are there, some of which you may be using, some of them are worth considering. If we can go to the next slide. These are really my top tips for anybody working in any service, but I think you may find things here. There is a legal duty around involvement, but it is quite limited. You shouldn't approach it as a legal duty. Be enthusiastic about it because it can really pay dividends for that. And don't think you have to do it all yourself. There are willing partners. Healthwatch work regularly with local services. So think about the opportunities that are there. I tend to use the cliche about steal with pride. If there are good things there, you can use it. An important message for me is go to where people are. The difference you can get if people are on their own ground is really important. They will tell you much more honestly if they're feeling comfortable about it. And always expect the unexpected. There are things that will come out that you really do not expect. Some of those, they may be tangents that you need not to get distracted by, but sometimes that will give you real gold. And the other thing is celebrate it. Celebrate it with your team, with your organisation. Celebrate it with the people that your service users that you're working with. Tell them what you've done. It's the big mistake that many organisations make, is not telling people how they've used their insight, because sometimes it is really impressive. And repeat that, keep doing that, please. It's completing that circle is probably one of the best things you can do. I was scheduled to finish at 1 o'clock and I'm dead on 1. So there will be time for questions later. We'll pick up some of those, excuse me, in the chat. If we, oh yeah, and if you want to get in touch with us, you can see where our contact details are there. And certainly, if there are ways we can involve local Healthwatch, we'd be really happy to look at those. Excuse me. And Now we come to the announcement. First, we have a highly commended clinical audit. I'm glad to see somebody's found the applause button. You'll find that in the feel free. I'm now going to open the virtual envelope, and I'm going to announce that the our highly commended hero is Laura Hall, and Laura is a midwife in Southport and Ormskirk Hospital, working on the Caesarean pathway project with the trust. And just to pick up on some things that I've been saying, what Laura was doing that was important was proactively looking for feedback, going out to people, finding out what their views were, but also demonstrating the change, showing how the insight had been used and making sure that services use that. There's good work with the Maternal Voices Partnership, which has a patient chair. Well, a number of examples of that, but one of them working on a leaflet to make sure that it met people's needs. But also, and I particularly like this, there's an ongoing commitment to working with people through monthly listening events. So I think so many of the things that I've spoken about, Laura has certainly been doing those. So congratulations, Laura, for being our highly commended audit hero. If we now move on to the winners, and I'm pleased to say we have two winners in the excuse me, in the Hero Award. Epilepsy 12 youth advocates and Side by Side with Solent Academy. So the work from Emma Sparrow, looking at youth advocates, and we can see some of the things that they've done here. And I think some of the important things about this, that the youth advocates, they select their own priorities. They decide what is important, and they work with them. There is co-design, including on resources, and I'm particularly interested to see that there was one for young people and parents with a new diagnosis, which again is going to be a really important area. But looking at their priorities, you can see they've got mental health support, so how it overlaps into other areas. And it also saw that they've been interested in transition to adult services, which again is a key area. And again, what the judges noticed was there was a commitment to collaborate over a long period of time. So this isn't just a one-off, oh, we're going to pick your brains. It is really about developing a relationship. So some excellent work there that really glad to see that work. And the second winner we have, and so this is the side-by-side group. I won't say too much because that they're going to be talking about that, but certainly very impressed with the involvement of people in planning and the way people are involved and supported to be involved with training and the wide range of issues. So that is really impressive, and I will now hand over for them to take you through their work.
Thank you. So I'm Colin Barnes, I'm Head of Improvement at Solent NHS Trust in the Academy, and I'm joined here by some of my colleagues in the Academy. And we've got two members of the side-by-side group here, and Sarah, who's another member who's joining us online. If you move on, well, actually, if you look on this slide, you'll see that previous slide was our website address. So if you want to find out more about us, www.academy.solent.nhs.uk. So on to the next slide. We are an integrated academy, so we do everything in the realm of improvement and research, starting off with our library knowledge service. Underpinning everything we do is patient and community participation. Actually, today we're here running our research and development programme. A lot of people on the programme actually have all previously been involved in audit and evaluation, quality improvement. So we also obviously run our clinical audit programme, our evaluation programme. We link that together with quality improvement. We're actively involved in outcomes. We do over 100 workshops a year teaching on a range of subjects that are related to that. And we are one of the, if not the most active community research trusts in the country. So Solent, we're based in the South Coast. Across Hampshire, we employ about 4,000 staff. So if you move on to the next slide. Thank you. So, as I say, our side-by-side group, I love working with these guys. They're involved in nearly everything we do, from research design to conference planning, presenting, co-production training to, as I said today here on our research development programme. We provide specific training for them, support, and pay them for their time and their expenses. So next slide. And as the speaker was saying, our involvement starts with the planning stage. So each year as a trust, we get together, look at our audit, evaluation, QI plans for the year. This is the picture of our planning event this year. There's our medical director taking the lead at the front there. So we have good support from our board. And at this meeting, we had 5 members of Side by Side who are working with the service line. Some have continued working with them, looking at the relevance really of the topics they're looking at and the importance of them to patients. It's so important that we have patients and the public involved in our planning. So next slide, please. And then moving on from that, in the actual projects, this year we had patients involved in over 20 audits and evaluations, and that can be things like looking at survey design, completing surveys, interviews, focus groups, as well as co-producing the actions for improvement, looking at interpreting what they've said. And all of that work is supported by our workshop programme, and our workshops themselves are supported by videos and all sorts of resources. And as I've mentioned already, that's all integrated with our other offers, like starting with the knowledge service, moving on to research. So next slide, please. And actually, it was this year's improvement planning event, the one I showed you the picture of, where we were talking to the side-by-side group afterwards, and we discussed this idea of having a patient review panel. So this is almost at the other end of the spectrum, sort of planning at one end to reporting and looking at actions for improvement. And so we launched this panel, and what we do is we invite audit, evaluation, QI authors along to the panel. They meet members of Side by Side. The authors present what they've done, how they've interpreted their findings, and what their plans are for improvement. And the panel asks questions, provide feedback, and then we ask the presenter to come back again to give an update to the panel 3 to 6 months later. And the idea there is to develop understanding on both sides, really, both Side by Side and the authors. And one of the authors, Eloise, has written there just about how useful it was to have the side-by-side thoughts on interpreting their insight and what could be done in the future. But that's probably enough for me, really. I'd like to introduce 2 members of Side by Side. So I have Julia and Sean here with us, and Sarah, I believe, is also on the call. So I'm going to hand over to them, and they're just going to talk a little bit about their involvement in this. So that's okay.
Hi, I'm Juliet, and I joined the team back in November, and it's amazing how wide and varied our involvement can be. And I particularly enjoyed the feedback panel. It gives you a chance to read the report ahead of that meeting time and to therefore consider some things that jump out from the report. But then it's a very collaborative process, and I think Eloise felt we were really supportive rather than judging her. And it was, I think, even more important that we then offered to be part of the journey going forward. So I know they had dates in place for 3 months, 6 months as part of that report, and so we're very happy to be involved with that moving forward as well. So it's a great opportunity to be involved and to help share our lived experience and with those clinicians.
And I'm Sian. I also joined Side by Side last November, having done some public patient interaction work before, and I have to say I have thoroughly enjoyed the work that I've done with Side by Side. It's a group that really invests in the public that come to join. We have had a lot of opportunities, face-to-face meetings, been offered training, which in a way that I've never been offered it before, to sort of help with some of the things that we would be then involved in. So it's been a very broadening experience for me. I really enjoy doing the sort of the reviewing type of things. I've done that a fair bit before, partly because I feel I can use my patient experience, not all of it a positive experience, but to bring about positive outcomes. But also it's just been very interesting to learn about what's going on, and then to be able to sort of use my passion for inclusivity and accessible writing and so on to just look at what's being done and to maybe see whether there are ways that things can be adapted to make them even easier for the general public to read and understand. Because if the research that's being done is going to really work, the people who are reading about it have to understand what they're reading, and that sort of outsider's perspective, I think, was interesting for me, and also Eloise felt it was useful.
I don't know if Sarah's on the call, whether she's got something else to add. I think that's
Hello there. Yes, I am on. Hello, yes, I am on the call. Thank you very much. It's great to be here and to join you today. Yes, I'd just like to echo everything that Sian and Juliet have said. I've been involved since November, and I found it really interesting. And we look at such a wide and varied selection of projects. And I find that our experience and skills are valued, and also we're listened to. And we do feel really much part of the team. And I think the actual being part of Side by Side is a very enjoyable process, and it's a very positive impact as well, as we're all trying to improve services for patients. So thank you.
Thank you. So from our point of view, you know, for me, I think it's part of it's all about relationships. It's about me understanding what my colleagues do and really valuing, you know, their work and understanding each other's work. And then the more I work with Side by Side, the more I want to work with Side by Side. And, you know, it's been great this morning actually talking with our research colleagues about the potential for involving patients. We pitched it to them last time, and since we spoke to them then, more and more of them have just started involving their patients in that. So thank you.
Brilliant, that's fantastic. And it was very motivating. I think you've set us all a challenge now to go back to our own organisations to see what we could potentially set in motion. It was lovely to hear it from your perspective in terms of how valuable you feel your input Side by Side is. So it was, yeah, a worthy win, and thank you for attending today to share that with us. So we're moving to the opportunity for questions. I've been keeping an eye on the chat, so I don't know whether anybody has got any questions or would like to raise their hands, and I will take hands as they rise. Stunned you all into silence. Jordan, we'll let Jordan go first. Your hand was up first.
Yeah, I just wanted to ask, perhaps for the speakers who have just spoken, for other organisations that have got something similar in place, when the project or when the group starts off in the beginning, how do you sort of find these willing, enthusiastic people and get them involved? You know, do you sort of do some sort of advertising, you know, put a flyer out there, or are these people who perhaps have come into contact with a service in in a negative way, and perhaps they volunteer to try and improve it for future patients, or have they had some sort of experience that's made them think, oh, I want to get involved? How do you sort of find these, great people?
So, hi, it's a variety of ways. So sometimes people will have been involved in other improvement projects. We're quite active on social media, so we put requests out. We work with some voluntary organisations quite a lot, and we do a lot of community engagement work, so we can go out to groups that way. May have been people who haven't had a great experience and want to make a difference. Might have been people who are partners. Juliet, Sean, have you got?
Well, just as an example of other organisations, I found out about this opportunity through the Royal Voluntary Service. So I was a volunteer with the NHS Volunteer Responders and saw an opportunity to apply to do this. So I think it's really important linking up with other organisations. I have a lot of patient experience in different hospitals, different settings, and would always be keen to see if improvements could be made within that. But it also helps me as a person to be involved. I bring skills. I used to be a teacher, and so I can bring all of those skills as well. So it's not just seeing us as a patient, but as a person who has lots of skills to offer to support these projects too.
And just to say also, what we've also do as a side-by-side group is we keep looking at ourselves and say, how can we involve other people kind of demographically, but also our services. So we keep, as a group, we make it a mission to continue looking at that involvement and how people are involved. But we do that together as a side-by-side group.
Brilliant, thank you. Kim, you've got your hand up.
Thank you, Vicky. Hi everyone from Side by Side, congratulations. I was involved in the judging panel and I just thought your submission was great. So inspiring to see a group of people coming together and being so involved from start to finish with a lot of your projects. So well done. I also wanted to ask about the training that you've received, and what does that look like, and where have you found that training?
Yeah. Well, I feel I've been very lucky because PPI work I've done in the past, sort of you're sort of given something to do perhaps, and then they'll say, if you need training, let us know. So you've got a very genuine offer. You know, if let's say we're doing Zoom calls and you're not familiar with Zoom, somebody would help you. And that's if you reach out. Now, the difference for me with Side by Side is that I have received notification of training that is going on within the trust that is not specifically for me to do a job that has been assigned, you know, that I've offered to do. It's not because I volunteered to do that. I have been able to go on a Quality Improvement Foundation course, which is offered to members of staff. But it was there and it was available, and I was able to do that, and I will be doing a further course. So these are things that broaden me as a person, and it's wonderful to be offered the opportunity to do them, because primarily actually it's helping me, but hopefully without being too much skin off the trust's nose. And then that education I can then bring in to the rest of my knowledge and experience that I can bring to whatever I'm doing. So that has been different for me.
I think with the training as well, we're always involved in the planning process for all of these events, and so we feel very much part of that. But equally, we bring ourselves, so we're not having to be the voice of the other people that we work with. We're given a platform to express our own opinions and our experience, our lived experience, and so they really value what we bring already, rather than feeling we have to be trained up to reach a certain point.
Yeah.
Lovely, thank you. Hillary's popped a question in the chat. Are there any top tips then for recruiting patient partners?
Yeah, my top tip would be go through existing relationships, and so like through clinicians who are doing lots of active in audit and evaluation and improvement, and then really work with people who are interested to get them involved and work with them to what they need to be involved. So rather than dictate it or really structured, find the people who are interested and then work with them to be involved, and then vary that involvement depending on what they want to do and want to learn or want to get involved with. And then really bring people together to create an environment where we can learn about each other, learn from each other, and support each other and work on things together. So they're my top tips.
Brilliant, thank you, that's excellent. I've just got, sorry.
One other thing to say about the recruitment. You can recruit somebody once, but will they come back?
Yeah.
And there's sort of a couple of very important things for getting people to come back. And one is seeing things through, because if you're involved in something and it might be quite a long-term project, it is wonderful that somebody thinks of you to then inform you what's happened at the end, rather than you never actually find out. So that follow through, I think, is also very important for attention.
Brilliant, thank you, that's excellent. Okay, we're not seeing any more hands up at the moment, but if anybody does have any more questions, pop them in the chat, because we will collate some responses post lunch and learn, as we've said. So if we move to the next slide, Sonia, just before we move to the Menti, then it was just to keep pushing you and setting you with those objectives to take back to your own organisation, really around go back and check that strategy again, check that programme, check how you are taking forward topics to include on your programme, and also taking forward those improvement actions as well, and then measuring that impact from a patient and service users perspective as well. I think these challenges remain current as they did last year, so it's just encouraging you to all go back and start having those conversations, or continuing those conversations if you opened them up last year. So I'm going to hand over to Jordan now, who's going to take us through an interactive Menti before we close with a few words. But I will thank you all already in advance for your presentations and your valuable input to today's event, and I'll hand over to you, Jordan.
Yeah, so I'm going to try and share my screen and bring up a Menti poll. Those of you who attended the Lunch and Learn yesterday probably took part in this at the end of the session, and the questions are very similar. Obviously, it's a new code and joining details, etc. So you should see the code and the QR code as well on the screen. So there's two options. You can just go to menti.com and enter that code there to join, or you can scan the QR code in the bottom left-hand side of the screen, and that'll take you to the questions as well. So I'll just pause for a second, because I'm not sure if the QR code goes on to the next, follows through on the following slide. So I'll just give it a quick pause to allow people to join, and then I'll go on to the first question. This is the first time I've used Menti as a sort of an administrator. I've only used it as a participant in the past, so hopefully it goes to plan. But the idea is the feedback and the comments, etc., and the scores will appear on the screen and populate as we go through it. So I'll move on to the first question, which should be a sliding scale. So a couple of questions about our speakers and our presentations that we've had. Obviously the feedback is much appreciated, so you should be able to just set your sliding scale on the screen. I can see the results are starting to come through now. I'm not sure if other people can see this, but I can see the sliders are going up, down, and calculating. It's all looking pretty positive. Obviously, all of this will get fed back to our fabulous speakers, and we'll collate any of the comments as well. What I'll do is I'll move on to the next question, just conscious of time. So we're asking, what is your top take away from today's session? So please just enter your comments, what you're hoping to take away from the session. I think I'll be taking away the fact that perhaps there's a lot more that we can be doing in terms of patient and public involvement. So hopefully we can take away some of the hints and tips that we've heard and apply them to our own organisations. So there's lots of responses starting to come through now. A lot of communication is key. Yep, I think we'd all agree communication is key. But how can we communicate with our patients more effectively, making sure that they understand what we're doing, the work that we're doing? How can we get them involved? The importance of involving patients. Yeah, they offer that sort of fresh eyes and patient perspective. So yeah, it is important to involve them where we can. They will bring a unique perspective and a unique set of skills. So there's lots of comments and thoughts coming through, lots of ideas. What I'll do is I'll move on to the next question in just a second, just to allow those last few comments and thoughts to come through. And then I believe this is the final slide. So we're just asking for any additional feedback about today's session. You can still put questions in the chat on Teams, and we will pick them up and pull them off, and everything will be collated. But if there's any sort of final thoughts or feedback about today's session, you can post them in here. And then I don't know, have you got a final slide to go through, Vicky?
Yeah, I think we've got a final quick summary slide, which we can move on to, just to basically just sum up the lunch and learn, really. I suppose it's thank you to Bren, thank you to Laura for a highly commended entry, and Epilepsy 12 for winning, also Solent Academy side by side. It was just fantastic to hear about your winning submission as well. We had some really good submissions this year, so yeah, worthy winners. Thanks for running the Menti, Jordan, and yeah, we've challenged you with a few things to really take back, and people have clearly taken this lunch to reflect, and we're seeing that coming through on the Menti, which is absolutely fantastic. So if you've got the opportunity to join us again tomorrow, we're going to hear from Dr. Aoife Mole, who's a senior clinical advisor at on the National Healthcare Inequalities Improvement Programme at NHS England, and we'll obviously have our Clinical Audit Hero for Health Inequalities announced as well. Obviously, if you can't attend all the lunch and learns, they are all being recorded for you to access and share widely within your organisation. So I think it's just a really big thank you to everybody, and a quick thank you to Sonia as well, who's been working behind the scenes to make sure this is running smoothly. So yeah, enjoy the rest of Clinical Audit Awareness Week. Keep sending in your feedback of what you're managing to do in your own organisations. And I don't think I mentioned it earlier, but it's about really signing up to that pledge around that continuous improvement through year. It's not just the week that we're thinking about this, it's thinking about embedding changes to really involve and engage with the patients and the public, so that it's embedded and it just continues to happen as we're undertaking all of our quality improvement work within our organisations. So thank you very much for attending.